So just reading out some numbers from Indian Council of Medical Research.
Okay.
They gave some projections for 2023 about non-communicable diseases,
Acha.
NCDs.
Mm-hmm.
In 2023, there were about 100 million diabetic people in India, projected as per ICMR.
Okay.
136 million pre-diabetic. Roughly 351 million people have abdominal obesity, which is your waist to hip ratio.
Right.
315 million have hypertension. So these are some of the NCDs. Now, obviously, most of the people will have 2 or 3 at the same time, right? So that's why this number looks so big. And if you look at the deaths from 2008 to 2030, the number of deaths is expected to jump from 4 million to 12 million attributed to NCD. Within NCDs, and this is where I think the topics you're talking about become super relevant. They also give the risks which lead to these NCDs. So there are different risks they list down. So let's say air pollution is a risk, dietary risk is one, tobacco use, high LDL cholesterol, alcohol use, and high fasting plasma glucose, right? Dietary is ranked as number 3, the top 3 risk. And within dietary, low fruits and low whole grains are the top 2 factors which increase your dietary risk. Meaning if you eat low fruits or if you eat, let's say, low whole grains, low legumes, high sodium, you have low nuts and seeds, you have high trans fatty acids, low vegetables, low fibers. These things increase your dietary risk and you are more likely to have NCDs, right? And I think most of the NCDs, as we got deeper into it, it's a huge industry now in India, right? Because like you said, people are, once they are on blood thinner, they are on blood thinner, like they don't get off, right? And second, if you're regulating your blood pressure, if you are taking any other medicine to manage your NCD without addressing the dietary risk, meaning how you change your eating habits, or if you don't focus on physical activity, or if you don't change your lifestyle, meaning if you are sitting for long hours without uninterrupted sort of activity or same posture, that also leads to that. So I think this is where I thought, entrepreneurs like you who are talking about health snacking, right? And that's part of obviously dietary risk. That becomes very important. So till about 6 months ago, I did not know that NCD problem is so big in India. And India is now being called as Diabetic Capital of the world. And that's a huge risk, right? Because on one hand, when we, from business community, when we talk about building India, we always claim that we have the demographic dividend. That means we have the lowest average age youngest population. Europe, Japan, America, all are on the decline, and we are the sort of, if China is the factory of the world, we are the office of the world.
Absolutely.
Right? Because we have the knowledge workers and all those things. But with these factors, right, this really impacts that productivity as well.
Yes.
So I think it's worrying, and I don't know why people don't talk about it often, especially now. So that amazes me, that why don't people talk about it? And these numbers are like really
they are mind-boggling.
Mind-boggling, right?
They are mind-boggling, and I mean, I would just like to add that people, so diabetes, yes, if you have diabetes or any of the pre-diabetic conditions. So when you are pre-diabetic condition, you are as good as having diabetes yourself, because that day will not be long where you will have diabetes. So people are happy we are pre-diabetic, we are not having medicines, but they are on that range of sugars that is leading to diabetes. So if you have diabetes, or if anyone has diabetes, they do not need any other ailment or any other disease. It is a magnet of all the ailments. One diabetes and it will pull your blood pressure, it will pull your heart ailments, it will pull your osteoporosis, it will pull everything will come slowly, slowly. So one diabetes, it is so khatanak and it is so, it's a menace. People don't really take it seriously. But if you have diabetes, then you are inviting all the ailments to your body. And one more, very important thing which I thought about it, that your body is your real estate. It is a real estate where you are living. And real estate prices are going up everywhere.
Yeah.
But this price is going down. People are really not really understanding the importance of this real estate. Decorating and going out and investing in such big properties and not investing in yourself. So if you invest in a good property, why don't you spend money on yourself? That way you are not, because somewhere, we lack the awareness. Somewhere we lack the community living, where if I am healthy and I am happy and active, it is infectious.
Yeah.
You would like to do that. So for that, there are very few people talking about it. And more of them, I have seen, there's some kind of, selfish behavior. कि हम तो ठीक हो गए हैं, हमने नहीं बताएंगे हम ऐसे क्यों हैं. वो अगला बीमार से मर रहा है तो मरे, बट मैंने अपना लाइफस्टाइल ठीक कर लिया and I am happy, and why should I keep on tom-tomming about it?
That's true.
So talk and build a community around you which is healthy and happy, because I don't want, if I am here and I have my friends around, I would like to be with them for the longest period of time.